tattoo. Tattoo artists want your tattoo to heal perfectly and look good just as much as you do, so they shouldn't give you any poor advice. 2. Leave the bandage on for 2 to 24 hours. There are two types of bandage and plastic wrap. Once the tattoo is complete, your tattoo artist will clean the area and cover the tattoo with a bandage or plastic wrap. They are also extremely absorbent, which allows them to be left on the tattoo for up to 24 hours before needing to be removed. 3. Carefully remove the bandage. Most artists agree that you should keep your tattoo covered in plastic wrap are the exception, but never be left on a new tattoo for longer than 2 hours, but the recommended maximum amount of time varies between 4 and 24 hours. It should come off easily once wet. Discard the used bandage. 4. Gently wash the tattoo. Use your hands to gently rub the tattoo, removing all traces of blood, plasma, or leaf stains. Do not use a washcloth, loofah or any type of sponge to clean the tattoo, as these may harbor bacteria. Do not hold the tattoo directly under the water. 5. Let the tattoo air dry. Once you have thoroughly washed the tattoo, you should gently pat it dry with a little paper towel. Do not rub the tattoo, as this may cause irritation. Once the excess moisture has been removed, you should leave the tattoo uncovered for 20 minutes to an hour. 6. Apply ointment. Once your tattoo is fully dry and the skin begins to feel tight, you can apply a little ointment, such as bacitracin or A&D, to the tattoo. Make sure to apply only a very thin layer that's just enough to make the tattoo shine, and rub it in gently until it's absorbed by the skin. 7. Continue to wash and moisturize your tattoo 3 to 5 times a day. You should continue to wash your tattoo with antibacterial soap and warm water until it is fully healed. This can take anywhere from 3 to 6 weeks, depending on the size and location of the